Well, welcome everyone to our information session about this request for applications for the small scale incubation funds to identify best practices for locally rooted produce prescription models. My name is Linnea Webb. I'm the project manager for our REACH grant, and I work here at the Swetland Center for Environmental Health at Case Western Reserve University. We're glad you all could join us today. We're basically going to go through the request for applications and see if y'all have any questions. So if you think of something or have a question, feel free to pop it in the chat. You should be able to come off mute as well, or you can raise your hand and we'll try to make sure we catch everybody's questions. Go to the next slide. Okay. All right. So yeah, we're going to cover what the grant is, what the RFA is, and then eligibility requirements. Is this the right thing for you to apply for? And then the application process, walk you through the steps of that. And we'll have more Q&A at the end, but if you have questions throughout, feel free to pop that in the chat. Okay. And we do have some norms of engagement that we always share at each of our meetings, just to check in and kind of center ourselves in this space and as we're interacting with each other. So assuming good intent and trusting we're all here because we believe in, we're committed to realizing a food system that promotes freedom, agency, and dignity in food traditions, resulting in holistic health for all. Conducting a self-check-in, so thinking about what you're bringing with you today, and how you can ground in the intent of this meeting, creating a welcoming culture and space, and making sure that this is a safe place where everyone can be heard and collaborate together, making the best use of our time together, and then holding ourselves accountable. So, are we living into these values, norms, and agreements? And then this is kind of an extension of that, our team agreement. So this is how we agree to interact with each other in a respectful way when we're meeting together. So taking space, making space. All voices are important in the conversation. Try to be fully present, lean into the conversation, engaging in active listening. Remembering that intent doesn't always equal impact. So trust that we're acting in the spirit of good intentions, and then taking responsibility if your intent results in unintended or harmful impact. Take the lessons, leave the names. What's said here stays here. What's learned here can leave here. I will say there is a little asterisk on this one because we are recording this session today. So it will be going up on our YouTube channel, so that will be available publicly. And then connect, don't disconnect. So if there's any conflict, we'll engage with respect, intention, and care. And then these are our REACH commitments for our REACH grants to nutrition equity, which we define as a state of having freedom, agency, and dignity in food traditions, resulting in holistic health in body, mind, and spirit for people and communities. And key features of nutrition equity are investment in community ownership of local food systems, balancing supply and demand for fresh and healthy foods, and supporting basic food needs with dignity. Okay. So I think we don't have a huge group, so I think we probably have time if you'd like to share. You don't have to, but you can share your name, your organization, why you're interested in applying for the RFA. If you don't want to come off mute, you can also share that in the chat as well.
Well, hello, everyone. Can you hear me?
Yes, hello.
Oh, hello. My name is Victoria Trotter, and I'm the Executive Director of Green Movement Glenville, an urban farm in the historic community of Glenville. And I'm interested in the program because I do believe that we can solve most of our health disparities in our community with access to fresh, healthy food. So I believe food is medicine, and I'm looking for ways to provide a resource to our community for that.
Great. Thank you, Victoria. Does anybody else want to share?
Yeah, I think you could hear me. Can you hear me?
Yeah.
Yeah,
Mhm.
my name is Dr. Rhonda Turpin. I'm Executive Director at Share Homes. I work with high risk youth and young adults ages 16 to 24. But I feel that fresh produce, this is really big. It's a dry area around where we are, all up and down Lakeshore, where days closed, and it's not fresh produce anywhere. So I've just been trying to look for any type of ideas to get some produce there. They did bust to the other days, and you know how long that lasted because it's thousands in that area, and it's right across the street from three large high rises and then a whole set of projects directly across the street from where Dave's used to be, and it's zero produce for miles. So that's always been a passion of mine, but I'm not really sure what to do. I talked to Councilman Polensik and he agreed, but I'm not really sure. So that's why I'm here.
Yeah. Thank you so much for joining. And that's definitely something that where throughout this RFA and our REACH project as well is really looking at areas of the county, specific neighborhoods that need more access to fresh produce. And that's really one of our a cornerstone of our work is focusing on the areas of highest need. So thank you for sharing. I see some people are introducing in the chat as well. If anybody else wants to go, can share. If not, we can move on.
Hi, my name is Mikkel, and I am Community Engagement Coordinator at New Point Community Development Corporation. Um, I'm not sure if this is necessarily a good fit for our organization, but we have a number of vibrant gardens and urban farms within our service area. So I'm just intrigued and want to know more about the program itself and how it can reach people on the southeast side.
Thank you, Raquel. Okay. All right. Well, feel free to put that in the chat if you'd like to share with others. Can go on to the next slide here. Okay. So we're going to go give you all an overview of what the REACH grant is. So REACH stands for Racial and Ethnic Approaches to Community Health, and it's a grant that the Centers for Disease Control and Prevention, or the CDC, created, and the purpose is to improve health, prevent chronic diseases, and reduce health disparities among populations with the highest risk or burden of chronic disease. And the CDC REACH grant is nationwide. I think right now, like this, it's the current grant cycle is 2023 to 2028, and I think there's an award in almost every state, if not all of them. And so here locally, the Cuyahoga County Board of Health received the REACH grant from the CDC. And so we are one of their, we're a sub-recipient. So we're working with the Board of Health on their REACH grant. And our focus is the fruit and vegetable strategy. So our goals are to increase the number of people using fruit and vegetable incentives and produce prescriptions in communities at the highest risk or burden of chronic diseases. We also want to increase the number of clinical healthcare sites that are prescribing produce, and then ensuring local produce prescription programs are tailored for the communities that we're working with, so those at highest risk of chronic disease. And we're currently in our third year of the grant. In the first 2 years, our team conducted a landscape analysis of produce prescription programs in Cuyahoga County. And we'll put all these links in the chat as well, and you'll get the slides afterwards. You can read that report to learn more about what we learned from local community members that have been doing this work for a while. We also implemented a 6-month REACH fellowship to support co-design of produce prescription programming. We had teams of growers and clinical staff, nutrition educators who designed produce prescription programs. And we also provided technical assistance, one-on-one sessions with people interested in starting produce prescription programs. So helping them plan and apply for funding. And then we also started the Produce Prescription Working Group, which is a collective of over 60 individuals that are working to advance policies to expand locally rooted produce prescription programs across the county. And that group is open to join. So if you're interested, you can learn more on our website. And you can also contact me directly to get more information. Okay. Darcy, I think I'm going to turn it over to you.
All right, thank you so much, Linnea. Hi there, I'm Darcy Friedman. I'm the director of the Marianne Swetland Center for Environmental Health, and I lead our sub-award from the Cuyahoga County Board of Health around the fruit and vegetable strategy within the REACH grant. So we're now going to review our request for applications, and if you have been looking at it, you're going to see there's a lot of overlap here. So the purpose of this RFA is to provide funding for the implementation and evaluation of 1 to 2 locally rooted produce prescription programs that seek to improve health among people in Cuyahoga County with higher than average burden of chronic disease. And the goal of these small scale incubation awards is to learn about the needs and opportunities of different PRX programs to guide expansion within Cuyahoga County over the next 2 years. So somebody did ask about, is this a good fit for me? This is a project that is focused on Cuyahoga County, so that's important to consider when thinking about eligibility. So what is a produce prescription or PRX? It's when healthcare providers prescribe free or low-cost fruits and vegetables to patients managing chronic conditions like prediabetes, diabetes, obesity, and hypertension. And patients are then going to fill their prescriptions in different ways. So they could go to a food pharmacy at a hospital or clinic. They could go to a farmer's market, grocery store, home delivery, and there are other options. But the key in the model that we're testing is the prescription does need to come from a healthcare provider who has the authority to write prescriptions for their patients. What does it mean to be locally rooted? For us, that means it's a community-driven approach that links healthcare sites with local food resources to provide culturally familiar foods, recipes, and education. So this might include community partners engaging in the design of the PRX program. You may be integrating foods from local farms, or you could be engaging chefs or nutrition educators who are culturally connected to your patient population. Some of the things that might be included, and again, flexibility is key, but these are some ideas. We want to make sure your program is meeting people where they are by providing the produce prescriptions tailored to the health needs of the population. And that might be through culturally relevant nutrition education and skill building to support behavior change. So if you look at our landscape analysis, sometimes that may have included cooking classes, demos, recipe exchange, partnerships with local growers to source high quality fresh food, and then patient-centered models to increase uptake. So if you're serving a population that has a specific food tradition, how are you integrating that into your design? For this particular RFA, we define a partnership is required for the award, and it must include at least one healthcare site and one community partner in Cuyahoga County. And the community partner can be a community-based organization, nonprofit, small business, etc. Some people have asked us, what is an incubation award? It's like a pilot, but we do have a very specific goal to support testing of processes through small scale implementation. So the idea in this is to take those lessons to inform how you might scale your PRX program in the future. And we do have a goal that programs that go through the incubation phase will eventually move into a more of a sustainable implementation phase. In order to be eligible, you must be an organization operating a PRX program within Cuyahoga County. You must be in good standing with the IRS or have a fiscal sponsor that is in good standing with the IRS. You must be a healthcare site or have a partnership with a healthcare site that is referring patients to the program. And you must be applying for a maximum of 15,000. If you go over that amount, then the award or the application would be considered ineligible.
Hey,
I'm going to
Darcy.
go through,
Oh, go ahead.
yes, I was just
I
going to
just
go
saw
through the,
Mikkel had their hand raised.
oh, okay, Mikkel, yes.
Hi, I just wanted to know if there is a limit to how many partners can be involved.
No, there is no limit. In terms of requirements, the recipients must complete the following during the award time frame. So you must implement a PRX program that is locally rooted. This is not an award to design a program. We do need to see implementation, and you need to have a goal to enroll at least 25 people. Within the project, you need to identify 2 to 3 learning goals for your small scale incubation award. So for example, maybe your learning goal is figuring out how to engage a certain kind of vendor, or how to tailor your program in a certain way, but those are part of your learnings. And you also have to conduct evaluation. There will be required tracking of the number and amount of produce prescriptions that you give out and that are redeemed. And then you have to track at least one other process or outcome measure that you identify in the logic model in your application. It is required that a de-identified data about your produce prescription program will be shared through a data use agreement with the Wetland Center, and we'll create a standardized format for sharing that. And those data will then be shared with the CDC as a part of our quarterly reporting requirements. We ask that all applicants complete a sustainability plan by the end, and you will receive some technical assistance with that. And then there'll be 2 progress report meetings, and we'll ideally at least have one of those coming to your site so we can meet each other in person. There are some optional supports that you can take advantage of if you're interested in applying, and these would be provided to you at no extra cost. They're not required, but when you apply, you can indicate interest, and for each additional support you select, you will receive an additional point in the scoring process for your award. So we will have some standard operating procedures available that are being developed through our produce prescription working group that can guide your program implementation. You have the option of having a coach to work with you to inform program delivery and quality improvement. You can attend technical assistance sessions focused on program evaluation. You can join a community of practice for PRX program implementers in our county. And you also will have the option for one-on-one technical assistance to guide your sustainability planning. Again, those are optional and at no charge to you, but you do not have to take advantage if that's not of interest. In total, the budget is $15,000 max, and the cost may support staffing, materials for enrollment and tracking of patients, nutrition education, cooking tools, and transportation costs. And no more than $3,000 of the total budget may be used to cover food costs. Funds may not be used to pay for clinical care. And it's important to note that if you're using food in your cooking, in a nutrition education, for example, and also paying for the prescriptions, those together would be both considered food costs. So a total of $3,000 max on food. The award will be a contract with Case Western Reserve University. The awarded entity or the sponsor, they must demonstrate the ability to accept the funds. And we will have a mandatory meeting with Linnea, the program manager, in person at the Wetland Center on March 11th to complete the required paperwork to receive payments. If you're awarded, you'll submit a first invoice near the end of March, and that will be for 50% of your total budget. After your first patient is enrolled, you can submit a second invoice for 25% of the budget, and then the final invoice will come by August the 7th for any remaining costs that you have. So for example, if you budgeted enrolling a certain amount of patients and you did less, then we would be deducting those costs from the final invoice. And payments may take up to 45 days to receive after the invoice is submitted to Case Western Accounts Payable. So keep that in mind. Even though the first invoice comes at the end of March, the payment may not come to you until the beginning or middle of May. So before we go on to the details about how to apply, we wanted to open it up for any specific questions you might have about the RFA overall.
Darcy, I
Right?
did see that Alyssa had responded to Tanisha's question in the chat about the budget. Um, could this funding be asked to a bigger budget? Like if the project total cost would be 20,000, could this $15,000 award support that, like supplementing?
Yeah, if you have a bigger project that you already have like an additional 5,000 that you have available, and I mean, you would want to be very clear in your budget what 5,000 is covering and what 15, and that, these are the costs that are directly coming from this grant. It is important though that if to be clear, if you already have the 5,000 or if you are still waiting to see, and I think that would be important if there were components of the 5,000 that, might be at risk if you didn't receive, those additional dollars. But it is possible to say that. It's just you'd want to be very clear about what specifically you're asking for with no more than 15,000 in this RFA. Any other questions?
Are there other limitations for the budget besides just the food costs?
There are a number of limitations that REACH has for us as awardees of the main, the subrecipient. So those are all added to the RFA. There actually are a lot of them, and we copied and pasted all of them because we figured we better just make it clear. But they're kind of like traditional things that you usually can't use federal dollars for. Lobbying, you can't, buy big infrastructure, things like that. But there is a full detailed list in the RFA.
Okay, thank you.
Any other questions? Okay. Linnea is going to now walk you through the process of how to apply.
Okay. So our application is open, um, and it will close on February 15th, at midnight. So that's a Sunday night. So you got a few more weeks left to apply. And then we're planning to have interviews February 25th, 26th, and 27th with eligible applicants. We may not invite everyone who applies as long as you meet the requirements. You'll be invited for an interview. And then the final decision will be made by March 5th. So we'll notify all applicants either way by March 5th. And then if you are selected, those awardees will be invited to meet with me, as Darcy mentioned, March 11th for about an hour. It probably won't take that long, but we'll be going through like all the paperwork to make sure you're set up to receive payment from Case. Okay. So you can, if you have, your cell phone handy, if you're on a computer, if not, we'll put the link in the chat. It's also in the RFA. We'll email everyone afterwards all these materials. So you can apply there. And this is what on the right side, this is just a screenshot of what the application will look like when you open it. So there's several components to the application. It's essentially 4 pieces. So there's the written application. So when you go to that link, you'll start filling out, answering the questions in there. There are several short answer questions. And then there's 3 supplemental materials. So your timeline for your program, which is in Appendix A of the RFA document, your budget, which is Appendix B, and then the logic model for your program, which is in Appendix C of the RFA. So you'll have a spot in the application where you can upload those files. So the interview process, when you're filling out the application, you'll select times that your team is available. And then if you're invited for an interview, we'll contact you by February 20th, just send you an email to confirm the date and time for your interview. And these will be virtual, again, February 25th through 27th. And then we'll make our final decision, notify applicants March 5th.